All right, Lagos, it's that time to have great conversation because this is Lagos Talks on the Smooth Breakfast here on Smooth 98.1. Love music, love life, most definitely. My name is Ayokunmi Kikireko. And you know how we always do, we get to have conversations about different issues and, just get some insights, get some perspective as well. And you also get to have your say. Welcome to another interactive session, as it always is. And today we join the global community to commemorate World Hepatitis Day 2025. Yes, indeed. This year's theme is powerful in its simplicity, if I can put it that way. Hepatitis, let's break it down. And that's exactly what we're going to be doing this morning to break down the myths, the facts, the fears, the realities of a disease that affects over 350 million people globally, including millions here in Nigeria. So it is not something to be trifled with at all. It's a silent threat. And it often goes undetected, untreated, and misunderstood until it causes some major damage. But with the right knowledge, the right action, and support, we definitely can change this particular story. Joining me to have this conversation, to give some insights, to share some knowledge, to bust the myths, is Dr. Lilian Ochayi. She's a public health physician who is dedicated to community health education and disease prevention as well. Very good morning to you, Dr. Lilian. Great to have you on the show once again.
Thank you very much. Good morning, Aya. It's good to be here.
Yes, indeed. Always a pleasure to have you to talk about these major issues. And hepatitis is definitely one that I would say should be at the top of any list. But before I go any further, if you're listening to us right now, you can join the conversation on YouTube. We're streaming live at Smooth 981 FM Lagos. Smooth 981 FM Lagos. You can leave your comments in the chat box there. Any comments you might have, any questions that you might have, because trust me, there could be some things you want some clarity on. So leave the comments in the chat box there and I'll take them as we get along. So let us start with the basics. I mean, hepatitis, it's a word that many people, I'm pretty sure, have heard, but few fully understand. And when you add five different types, A through E, it gets even more confusing. And I've heard that there are even more letters attached to it, but let me just put that in the corner for now. Dr. Lilian, what exactly is hepatitis and what are the key differences between the major types? Talking about from A to E.
Okay, thank you very much for that. Hepatitis basically is an inflammation of the liver. So this is usually caused by a virus, right?
Mm,
And basically it causes an infection, which then leads to the liver being inflamed. So, when this affects the liver, the functions of the liver, there are a couple, the liver performs so many functions. It helps to store energy, removes toxins, it aids digestion, so many other things that it does. So when the liver is affected, the body is not able to the liver is not able to perform these functions, right?
mm,
And so, you know, then we start having issues. And like you said, there are five main types. That's the A, B, C, D, and E. And they have like different causes and different ways in which they are spread. So, and we have some that are similar, like the A and E, right? They are spread
okay.
mostly through contaminated food and water. So if a person, doesn't practice good hygiene and, you just drink bad water or you don't wash your hands before, food eating and things like that, there's a chance of getting either hepatitis A or E. So that's the way it's
Right.
spread. But they're usually just short-term infections. They like a lot of a couple of viral infections, they are self-limiting. So this means that after a period of time, the infection resolves on its own and it doesn't like leave any lasting or long time damage. So that's that for A and E. Then B and C are spread through blood, and other body fluids. So we can get that through unprotected sex, sharing of sharps, from mother to a baby at birth. So those are like the most common ways
Mm.
in which hepatitis B and C are being spread. And these
Okay.
ones go on to become chronic. So they are the ones that lead to liver, something we call liver cirrhosis. That's when the infection has progressed to a point where the liver becomes scarred. So it
Mm.
progressed to that, and then it can also progress to liver cancer. So that's for B and C. Then hepatitis D, which is the last one, it only occurs in people that are infected with hepatitis B. So that kind of makes it worse.
Ah,
Yeah, so you can't really get hepatitis D if you're not infected with
with with
hep-
hepatitis B.
yes, exactly. So
Huh.
and if that's now it's so let's just say it's kind of like an opportunistic infection, right? That it only happens
Okay.
when this exists. So and if that also happens with hepatitis B, it generally makes the person's condition worse. So basically
Right. Right.
that's
Right.
just the overview of the five main types of hepatitis.
Okay. Okay. Okay.
Yeah.
Interesting. So, is it always guaranteed that anyone that has hepatitis B will develop hepatitis D? Is it always guaranteed?
No, it's not always guaranteed. It just only happens that they are more at risk of getting it, and it's only when someone already has hepatitis B that they can have it. But it doesn't mean that everyone that is hepatitis B positive will end up also having hepatitis D.
Right.
It's
Right.
just
Point.
like the relationship between HIV and tuberculosis. Sometimes a person has HIV, it increases their risk of, also getting tuberculosis, but
Mm,
it doesn't mean that
doesn't mean.
they
Right.
automatically
Right.
just get
Right.
it. Yes.
All
Yeah.
right, point very well taken. Now that we've broken down the different types, let's look at the scale of the issue. Now,
Right.
we know that hepatitis affects people in every part of the world, but it's especially prevalent here in sub-Saharan Africa. Now, looking at this, how huge of an issue is it globally and also here in Nigeria, and who are those who are most at risk of actually getting it?
Right. Thank you for that. So, globally, right now, we're looking at over 300 million people that are living with chronic hepatitis B and C, right? And in Nigeria, as at 2023, we had over 20 million people infected with same hepatitis B and C. So that's, a very significant number.
Oh,
And
yes.
the problem there is that a lot of these people do not even know their status, because most of the times they don't have symptoms, you get. So over
Mm,
time, a person could just live their life for years and not know until something serious now hits them, and or some people might even find out when they go to want to do like blood transfusion, and they do that screening. That's when some
yeah.
people tend to find out. So, um, that's a major issue. And what you said about people at risk, so um babies or people generally born to infected mothers, so that increases their risk. If a mother is hepatitis B positive, in fact, that is the most through birth and during delivery, that's the most common way a person gets hepatitis B most especially. So through mother to child transmission, and also people who receive blood that is not properly screened. I
Okay.
mentioned,
Okay.
yeah, so when we're doing, if blood transfusion is sorry, going to happen, there's supposed to be screening of some of this, viruses and everything before a blood
Mm,
is going to is deemed safe to be transfused. So if a person receives blood that is not screened, there's a chance, that blood could have the hepatitis B virus in it, and then, someone
Oh
could get
dear.
that. Then people who engage in unprotected sex, right? Then, like I said, sharing of sharps, razor, needles, things like that, because it's blood to blood contact and everything. So that increases their risk. And then also we health workers are also seriously at risk because, we do deal with lot needles and things like that. And
Hmm.
then these patients come to the hospital to seek, medical care, and also we're exposed to them also. So these are generally the people that are at risk of, being infected.
Hmm. Man, there's so much. I mean, just listening to all the groups of people who are at risk of this, it just I don't know, it just gives me this feeling of man, there's a lot going on. And of course,
Yeah,
looking at the number of people who are actually living with it at this point in time, that also tells a very, very big story as
right,
well.
right.
Huh. All right. I'm going to take a very, very quick breather here. When we come back in, we'll begin to look at the symptoms and, of course, diagnosis as well, because that is also a very, very key part of this conversation, gives us a better understanding of what it's all about. Lagos, keep it tuned. This is Lagos Talks on the Smooth Breakfast here on Smooth 98.1.
Well
Okay, quick,
done.
and then we'll jump back in. I
Okay.
wanted to, I wanted to avoid us getting into the next set of questions, and then I'll have to cut off because time was already.
Okay.
So I just had to drag it to
Yeah, it's
9:14 and just get into the ad. So we'll do that real quick, and then boom, we'll jump back in.
all right.
Okay.
Providence Bank, redefine banking by synergizing innovation, expertise, and personalized service. Our commitment to excellence drives to create value for individuals, corporations, and institutions. Our comprehensive products and services range from personal and affluent banking, catering to the top tier HNI and ultra HNI markets, to corporate solutions, providing strategic guidance to SMEs, emerging corporates, local corporates, and multinationals. Our relationship managers are dedicated to understanding the goals of customers and delivering service with speed, efficiency, and courtesy, embodying the concept of service with a smile. Convenience is key as our digital platforms empower our customers to manage their finances seamlessly. Our best in class mobile application, Providence Plus at Corporate Internet Banking, provides cutting edge solutions to enhance customer experiences and stay ahead of the ever evolving financial landscape. Providence Bank, future forward banking. Providence Bank, future forward banking. The smooth drive home. Tomorrow, right here on your dial. 98.1. I love my radio. Radio is my all-day companion. Infectious rhythm. It's all about your big songs. The right kind of music. It's all about your fresh news and information. All the information I can get. News I can get. From the house to the car to meetings. And it's all about great ingredients
Kidoki.
for your journey home. Reporting this traffic check. The smooth drive home, right here every weekday from 1 p.m.
Welcome back.
We're back in.
All right, cool.
All right, welcome back into Lagos Talks this marvelous Monday morning here on Smooth 98.1. Love music, love life. It's 17 minutes past 9 a.m. Ayokunmi Kekirekun here, and my very special guest in the person of Dr. Lilian Ochayi. Today, we're talking all about hepatitis. Yes, today is World Hepatitis Day, and it is a health issue that is of the utmost concern, and that is why we're having this discussion this morning. You also can join in and weigh in on what we're talking about. Any questions that you might have, any queries, because I'm pretty sure you've heard myths and so on and so forth. And we're here to debunk all the myths and give you the most appropriate information. So all you need to do is to join us on YouTube. The live stream is at Smooth 981 FM Lagos. Smooth 981 FM Lagos. Leave your comments, your questions, your queries in the chat box as well. And of course, we shall do our best to get those answers that you very, very well need. All right, Dr. Lilian Ochayi, welcome back into the show. Thank you once again for joining me.
Thank you.
All right, so before we went on that break, I actually talked about us diving into the symptoms and diagnosis as well. I mean, we know that one reason that hepatitis is so dangerous is because it's often called a silent killer. Symptoms are subtle, and many live with this unknowing that, as you alluded to, that some people don't find out until they go for maybe they want to uh, donate blood, and then they are screened and they find out, boom, that they're actually living with it. Now, that being said, what are those signs and symptoms that people should look out for? And how can someone get tested if they suspect that they may be infected?
All right. Thank you very much, Aya. So, like you rightly said, the a lot of people may have no symptoms at all for years. Even when liver damage is occurring, there still could be no symptoms. But that's why it's very important to get screened, right? To ensure that you check because you just might not know in time. But signs that we could look out for, there's yellowing of the eyes or skin. It's called jaundice. That's one
Mm,
of the major symptoms. Then there's also dark colored urine. There could also be
okay.
fatigue, like just feeling tired a lot. Then nausea, vomiting, abdominal pain also. That usually like in the upper right part of the abdomen.
Okay.
Then joint pain. In some cases, the skin could get really itchy. So that could happen when there's just so much toxins that the body is not able to remove. So it just starts being very uncomfortable and itchy. So these are symptoms, that presents in cases where the person starts where it's gotten to a point where okay it is now serious, but usually they are not detected in the early stages. So, like what you said about testing, it's very easy. A blood test, you know, would help us to know if you have the infection or not. So, at a hospital or diagnostic center, and sometimes we have programs where people do screenings also. Like today now, there's probably going to be some organizations, carrying out free screenings and things like
Mm,
that. So it's good to take advantage of opportunities like that and just get tested. So it's that easy to know your status. Just go to a diagnostic center or hospital and request to have these tests done.
okay. So that being said, I mean, all we've spoken about in terms of how subtle symptoms are and so on and so forth. So would you then suggest that those who are probably most susceptible to contacting this particular disease, they should get tests randomly or at different points? I mean, what would you suggest or advise in that case?
Okay, yeah. So like I mentioned earlier, like people that are susceptible, like giving an example of pregnant women, right? Um it's usually part of the screening that is done for pregnant women before it gets once you go for your antenatal and you register, it's one of the things that are screened for. So this
Okay.
is also to aid proper planning. If a mother is positive, so we know what to do when a child comes, right? So that helps for that. Then health workers also, like I said, it's important that we do check. And then if it's negative and, then you can know that, okay, for that period, you're good. But at intervals, it's good to just check. So if a person then notices that they're positive, then you need to follow up with a doctor and also
Okay.
do monitoring and, seek treatment and things like that. But it's very important that we check from time to time.
All right. So thankfully, hepatitis doesn't have to be a death sentence. I mean, talking about treatment, because today there are treatments, some even curative, especially for hepatitis C. But let me not jump the gun here. Let me hear the directly from the fountain of knowledge in Dr. Lilian. I mean, what treatment options are actually available today, and how have things actually improved in terms of the access and the outcomes as well?
Right. When we talked about, I would treatment options based on the five types that we mentioned earlier. So for A
Yeah.
and E, I said that it is mostly gotten through contaminated food, water, and stuff
Hmm.
like that. So basically, they tend to resolve on their own, just hydrate, rest, and things like that. So they're usually not long term or chronic. But for the B, hepatitis B does not have a cure presently,
Ah.
but there are antiviral drugs that are used to reduce, control the virus, to manage it, to reduce the viral load, so to say, and then reduce a person's risk or chance of progressing to liver damage, liver scarring, and cancer, things like that. Hepatitis C is the one that does have a cure right now. So that one, it's usually like a 3 months course of direct acting antiviral drugs. So in some serious cases, it could take more than 3 months, but basically it's about 3 months, So that's those are the treatment options available for the five types currently.
Hmm.
Yeah,
So, anyways, I'm actually not too surprised when you mentioned that hepatitis B doesn't have a cure yet. That seems to be a common theme where viruses are concerned. Even talking about A and E, just they have to run their course more or less before
yeah,
one actually gets him or herself back to normal.
yeah,
And when all this is said and done, when we go forward, backward, side to side, I guess we can come to the conclusion that prevention is the most powerful tool that we have. And it's
definitely.
often straightforward, talking about vaccines, hygiene, safe practices. But that being said, what practical steps would you say people can actually take to protect themselves and their families from hepatitis? And how effective are the available vaccines that we have right now?
Right. Yeah, so you already said it, you mentioned getting vaccinated. That's at the top of the list because, especially for hepatitis B, the vaccine is effective and we know that it works, right? So if a person is vaccinated against hepatitis B, it's like 95% effective. So you can be sure at, up to that amount, that percentage that you're not going to have the
Mm,
infection, right? So being vaccinated, and there's also vaccines for hepatitis A, and they are generally safe. And it's important that everyone, if you're not, so how to protect yourself using that presently, you have to first get tested, then be sure that you're not infected, and then you can get vaccinated. So it's important that you test first before getting vaccinated because it's really not going to be effective if you're vaccinating yourself against something that you already have. So it's important to
mm,
first do the test, check if you have it or you don't, and then go ahead to get vaccinated if you're negative for hepatitis B. Then
right.
yeah, so also unprotected sex, it's good to use protection. Condoms are, we say, so in sex, right? What we usually say, we have our ABCs: abstain. And if you can't abstain, be faithful to one partner. And then if you can't, use condoms, right? So still, just, it's important to use protection. It's still not 100% because, there could be some things that could go wrong with condoms, but it still provides protection up to some level. So that's
Hmm.
another way to protect ourselves. Then avoid sharing needles, sharp objects, toothbrushes, things like that.
Even
Um,
toothbrushes.
yeah, because if a person, so this would bring us to talking about one of the myths, right? Like they say, oh, maybe you can get these things through saliva or things like that. So usually if a person has an injury like a sore or something in their mouth, and
Right, right,
there's an
right.
opening, so that could cause some transfer there on the tooth. So basically that's how that could work. So that, and then good hygiene for to prevent A&E, so washing hands, eating food that is clean, properly washed, and all that. And also just ensuring that blood is properly screened before transfusion. So that one is also very important. A lot of people assume that a person gets hepatitis only through sexual promiscuity or something like that. But
Hmm.
we have a lot of children that just got it from their mothers through birth, and then some people that just got it through being transfused with blood. So there are other ways in which, people get it. So it's important that we check that blood is being properly screened before we transfuse a person. So
Hmm.
yeah.
All right, thank you for sharing that, Dr. Lilian. Thinking about what you said about the open wounds and all that's very, very similar to what is said about about HIV as well. Well, they are
Yeah.
both viruses anyway, so
Yeah.
uh, they're similar in that regard. All right, let's take another break right now, and then the conversation will definitely continue. We'll be looking at the impact that hepatitis has on lives and mental health as well. Keep it tuned. We are making progress. Man,
That's good.
uh, just the man, it's stressful, Sha. Just the thoughts that it doesn't have a cure. Why are
Hmm.
viruses so stressful?
I
I
don't
still,
know. It's just, but hopefully, Sha, like at some point there was no cure for hepatitis C, and then eventually they came up with one. So we'll just keep our fingers crossed.
but I wonder how can there be one for C and not for the others? Because C is also a virus. So
But they still have their different causes. They are still caused by, even though they are all kind of related, but they're still caused by different viruses specifically. So they've been able to only find a cure to that particular one.
now, wow.
As in, eh?
And you guys were in the field, man. We thought that and any small thing like this, it could happen. It could happen.
Hmm.
You all are doing the Lord's work. All right, if you're just tuning in, this is Lagos Talks on a Monday morning here on Smooth 98.1. Love music, love life. 32 minutes past 9 a.m. 28th day of July 2025. My name is Ayokunmi Kekiriako, and it has been so far a very interesting conversation talking about hepatitis. It is World Hepatitis Day 2025, and we're bringing the spotlight on that particular disease, talking all about it, everything that you need to know. It's not, as far as I'm concerned, it's not spoken about as much as it should, and that is why we are here right now. So if you'd love to join in on the conversation, any questions that you might have, any other any other what any queries, myths you might have heard, and things like that, you need to send those messages in. Let's get them answered for you, and then you can have the information that you most definitely need to protect yourself and protect the lives of those around you as well. Dr. Lilian Ochayi is doing such a good job this morning of sharing all that information. And there's a message here on YouTube. It's from Shewodiese. He says, apart from the viral hepatitis, people should also know about the ones that are caused by medication abuse. Some painkillers and antibiotics. The general public should avoid self-medication. Well done, Doc. All right, thank you for that one, Shu. I think she was also within the medical field as well. But Dr. Lilian, I mean, what would you say to those comments that Shu made? I mean, um, self-medication, abuse of some of this medication as well. Can you give us some insight into that?
Yeah, thank you very much for that. Yeah, so um she absolutely right. It can caused by, apart from the viral infections, there's also other non-infectious causes like medications. Paracetamol, like we know in high doses, can affect, the drug-induced type, can cause drug-induced hepatitis, some
Hmm.
antibiotics, even some herbal remedies and things that people take. It can also induce hepatitis and stuff like that. And then there's also alcohol, alcoholic hepatitis that comes from excessive intake of alcohol over time. So in that case, the liver becomes inflamed, damaged, and due to alcohol toxicity and stuff like that. So it could then progress to this scarring that I mentioned earlier, and
Hmm.
can
The
even lead to
cirrhosis.
yes, and then can even lead to liver failure if you do not properly addressed in time. So yeah, that's another way that hepatitis could occur.
Hmm. For those who love to abuse painkillers, who love to pump themselves or painkillers at every turn, you need to have a rethink because you're only doing such damage to yourself at the end of the day. And some people, any small painkillers, any small thing, painkillers, that is
Hmm.
something that needs to
Yeah.
stop. Everything doesn't have to be dealt with a painkiller. But back to the conversation and just walking through everything really, looking at the effects that hepatitis has on people's lives emotionally, mentally, socially. It's not just a physical illness at the end of the day. From your experience, Dr. Uchai, what kind of toll does hepatitis actually take on somebody's daily life and mental well-being? And is there any way that those around people suffering, living with this disease, communities, is there any way they can also offer some better support?
Yes, thank you. Yes, so it does have, its effects physically on the person, like I mentioned, if the liver is affected, the functions that it's supposed to carry for the body would not, be carried out. And then there's just, damage over time. And then physically, the person starts to experience some symptoms, and there's now some limitations in the things that a person can do. So yes, this can, seriously be stressful, even emotionally, having to deal with that. There's also a lot of stigma that people experience with this. Also, kind of like how there's a stigma associated with HIV, that if you have this, so people cannot come close to you, or people just make up things that, okay, this it can, if I'm close to this person, I could get it, things like that. And people just, start to pull away. So it's like this kind of thing. So stigma is also very important, can affect a person emotionally, and also just the symptoms and everything. All these things could over time tend to cause isolation, like a person just starts to pull away from people, could even lead to depression and things like that. So yeah, it does have, its negative impact. And it's very important that people around, in the community have, a better understanding of this thing and also try to reduce stigma, because a lot of times it comes from the people around us, right? They are the ones that look and make comments, and those things start to get to you. So if, as the community, we also play our part in reducing stigma and not,
Mm.
tagging people with, bad names or giving them funny tags, things like that. So that will help a lot. Also, being emotionally supportive for these people would also go a long way. And just if there are people around, and even this stigma also could even deter a person from getting help at the right time, and even prolong, a person, delay a person getting help, and then complications now start to come up. So it's good that we also encourage people around us to seek care early enough. So yeah.
All right. Thank you for sharing, that bit of information, because people who are living with this are dealing with so much, and then feeling like they're all alone in the world and all that doesn't make it any easier by any stretch of the imagination. Now,
Right.
I believe that another thing that doesn't make dealing with hepatitis any easier is misinformation, which remains such a huge barrier. I mean, some people think that it spreads through casual contact, or it can be cured with all sorts of herbs and concoctions, and goodness knows
Mhm.
whatsoever. But from your experience, in the medical realm, what are some of the most dangerous myths, or should I say misconceptions, about hepatitis that you've heard? And how do we even begin to correct them?
Right. Thank you for that. Um, I think the major one I know that I already mentioned is that, you are a person like has hepatitis is a promiscuous person. Like, it means you're probably sleeping around or
Mm,
just, yeah, so that's one. And obviously that's not true, because like I said, there are other ways a person could get hepatitis from their mother, an infected mother passing it to the child
right.
through blood transfusion, sharing of sharp objects, things like that. So there are other ways. So it's not only through sexual unprotected sex. Then some people also might believe that it is not treatable and it is always deadly. Fine, it is dangerous if it is left untreated, right? But it is treatable. At least we already mentioned that hepatitis C has a cure. And
Hmm.
even though hepatitis B does not have a cure, it can be managed, meaning there are antiviral medications that people infected can take that will reduce their viral load. So it even reduces their chances of spreading it to other people when the viral load is lower. So that's another one. And then, because many people don't have symptoms, some people might feel like, oh, when you have it, you are supposed to know or something. But like we said, there are no symptoms in most cases. So you still have to get screened. That is, very important. So these things that we're doing is good that we're doing them just to help people be more aware. Like you talked about the herbal concussion and things like that, that people would come and advertise and say, oh, this thing is going to cure this, that, you know, it is risky to take those things, like we mentioned just now, that even taking of some herbal mixes and stuff like that could even cause a person to have hepatitis over time. So that could even now make things worse and, cause more damage that we do not want. So it's best to seek medical care, see a doctor, get tested, and then also receive treatment accordingly.
Hmm. All right, man. So much to actually unpack in this, on this particular matter. But I'm glad we're doing that today. it's very important that these issues are laid bare like this, and I'm so happy that we're doing this. Now, as we begin to wrap all this up, it's important to remind everyone that change is possible, and every step we take, from getting tested to educating one another, it actually counts. Now, on today, that is World Hepatitis Day, what gives you hope? And what message do you want everyone who's listening to us right now to take away today from this, Dr. Lilian?
Right. So yeah, I think I would say what gives me hope is, that we're making progress. And it's good that we're making progress, even no matter how small or whatever, no matter, like, make just having some progress is good. And so far, like we're saying, at some point there was no hepatitis C cure, and now we do have a cure, and then there's also vaccines that are available, and also just this increasing awareness among, our community, people in our communities, ensuring that people know about these things to increase testing and all that. So this is, something that gives me hope, and that with all this, people are being protected and knowing what to do to prevent themselves from being infected with hepatitis and all the forms, and just being vaccinated. So that's what it is for me. And my message to every listener is that hepatitis is preventable, it is treatable, and even curable. So please get tested, get vaccinated, and also this would go a long way to save your lives and even those that are around you.
All right. Thank you so very much, Dr. Lilian Ochayi, for helping us to break it all down and for sharing your expertise and all the knowledge on such an important topic. It's been such a pleasure having you on the show, as it always is. Thank you so
Thank
very much
you.
once again.
Thank you very much for having me.
Alrighty. I hope you have a great Monday and a great rest of the week as well, with as little stress as possible. I'm very sure you know what it is that I'm referring to.
Yeah, thank you.
All
Thank
right,
you.
then.
I hope so too.
All right, Lagos, you've heard it all today. Hepatitis is serious, but it's preventable, treatable. With the right action, it is beatable. So just take that first step. Get tested, ask the questions, spread facts. Definitely not fair. And remember, the theme for this year is let's break it down, because when we understand the problem, then we can solve it. My name is Ayokunmi Kekiriakon. Thank you all once again for being a part of Lagos Talks this beautiful Monday morning. Keep it tuned to the Smooth Breakfast. I see you, Jeffta on YouTube. He says thank you. Thank you also for being a part of the show. The Smooth Breakfast definitely kicks on. I've got more great music lined up for you all the way to 11, getting you into the zone for a money-making Monday.